Welcome back to Suncoast FYI. Giving blood may not be the most comfortable subject to talk about, but sometimes it is so important because it can save someone's life. If you're thinking about giving blood, the Suncoast Blood Bank is the place for you to do that. And development specialist Ella Lua is here today to tell us more about how we can do that and where. So good morning. Thank you for joining us.
Of course. Thanks for having me.
Now, I know summer is a challenging time for several reasons for the blood bank. Can you explain to us why and what we can do to help with that?
Yes. So summer is a challenging time for us in terms of collecting donations. So we see our winter residents leave, and they are a very, very loyal donor base, as well as our high school students are not in school, and high school students actually provide about 25% of our blood supply. So them not being in school causes a big impact on our supply.
Okay. Now, and who else is eligible to donate in the community?
Absolutely. So anyone over the age of 16, if you're 16 years old, you need to have a parent with you, or a parent permission form signed. But anyone who's 16 or older and healthy is eligible to donate. There are some medications that preclude you, some conditions that preclude you, but during the donor screening process, they ask you all those kinds of questions, and they can let you know if that's okay or not okay.
Okay. Now, also, there's a huge need for blood on your website. It shows that there's everything is low and some are actually urgent.
Yes.
So what is a universal blood type that, I mean, I know you're looking for everything, but what is the most universal type that would be, you know, most beneficial?
Of course, all blood types are always needed. O negative is the universal donor. So if there is a trauma situation and doctors are not able to take the time to cross-match someone's blood type, anyone can receive O negative blood. That's why it's so valuable, and so it's actually very rare. It's very important for O negative donors to try and donate if they can. Currently, we're experiencing a critical shortage with all the negative blood types. So A negative, B negative, AB negative, and O negative are all low right now. So those are critical for us at this time.
Okay. And how often can a person donate blood? And how long does it take for them to recuperate, I mean, afterwards?
Well, the immediate recovery time is pretty brief, 10 to 15 minutes of resting, having a juice or a snack to just, kind of get your bearings back. Usually people feel fine right away, but we still want them to wait a few minutes before getting up and going on with the rest of their day. And of course, you can't exercise or do any heavy lifting the rest of the day. Take it easy after donating. Your body actually regenerates that unit of blood over the course of about 2 months. Every 56 days, you're eligible to donate.
Okay, that's great. That's great. And I mean, who needs blood?
Who needs blood?
When we think about it, it's like you don't think about it, but really, you can tell us some of the situations recently that's happened.
The thing that I think is hard for people to realize, or that people don't think about, is that there's no substitute for human blood. We can't make it in a laboratory. We can't synthesize it or create it. It is only from other people. So that's why blood donation is so critical. But most of our blood supply goes to treating cancer patients. About 50% of blood products go towards people undergoing cancer treatment, and trauma patients and surgical patients.
Okay. So is that where you've seen the largest increase in blood usage?
Well, recently, Sarasota Memorial Hospital became a full-fledged trauma center, and we are the sole provider of blood products to Sarasota Memorial Hospital. And we expect to see an increase because they will be receiving more trauma cases to their facility. We'll therefore see an increase in what we do for them with that. Okay. For example, there was one recent trauma where one patient used over 200 units of blood.
Oh my
One patient. So that patient did have a good outcome, and we're thankful to be there for them for that. But 200 units in one trauma, that's a lot. It's a lot of blood.
Now, I mean, that's just one person, and of course we need to bring up the subject of the Orlando shooting and how that affected the blood bank.
Yes.
Can you tell us how our community...
Absolutely. Well, as many people are aware, the shooting happened early on a Sunday morning, and that later on that Sunday we did get a phone call from the blood bank over over in Orlando, and we were able to send them some units of what they needed. And then the next day, when we opened up on Monday, we saw a huge outpouring of support from our local community to replenish that supply and make sure there are blood products for our community and for others that need assistance. So throughout that week, it was just amazing to walk in every day and see people waiting and so happy to give. You know, some people were there talking with other donors. Other people, you could just tell they were reflecting on the tragedy that occurred and donating. Really, I think it gave people a sense of purpose and a sense of hope and humanity.
Absolutely.
Yep.
Absolutely. It brings a community together.
It does. It does.
Now, I know that a lot of people will be concerned about how the Zika virus could affect the blood.
Yes.
And you were saying something earlier about you do testing.
Yes.
You do testing on all blood
Yes.
being donated or
Yes.
being given.
Yes, we go through an extensive process to make sure the blood supply is safe. That is a huge, huge goal of ours. So right now we are not actually testing for Zika because the test was just approved to do that testing. And until there's local transmission, meaning someone acquires Zika here in our area, we are not required to test for Zika. Right now what we're doing is if you have traveled to any area where Zika is locally being transmitted, we ask that you don't donate for up to 28 days following that visit.
Now, I know that you have a big event coming up. Can you share that with us?
Yes. Right now, we're actually in our Boots versus Badges campaign. It's a friendly competition between firefighters and police officers to see who can donate more blood. That's ongoing. It kicked off a couple weekends ago, and it's ongoing until July 17th, where we'll have a wrap-up party at the Sarasota Square Westfield Mall from 12 to 6. That's Sunday, July 17th.
Okay, and where can our viewers go to find out more information about that and about the blood bank?
You should go to our website, scbb.org. We have all of our blood drives listed up there. We have information about Boots versus Badges and information about our donor centers. They can come into one of our centers to donate.
Great, thank you.
You're welcome.
Thank you for all the wonderful work you do for our community.
Absolutely, my
Appreciate
pleasure.
it. Right after the break, Sue Forbes will join us. She is the owner of the Artful Giraffe, a gallery full of art from local artists, and it's located in our historic downtown district. We'll be right back.